Hello guys, today we'll discuss about hepatitis A, which is a general medicine topic. So first let's start with the etiology. It is caused by hepatitis A virus. This hepatitis A virus, it is an RNA virus which is 27 nanometer and it is non-enveloped. Whereas you know that hepatitis B virus, it is a DNA virus and it is enveloped. Whereas this hepatitis A virus, it is an RNA virus and non-enveloped. It belongs to picorna virus group. It is the most common type of hepatitis and it occurs more during epidemics. Why does it occur? It occurs because of overcrowding and poor sanitation facilitates the spread. So this is the etiology of hepatitis A. Let's look at the source of infection. So in case of hepatitis A, only acutely infected the persons who are infected with hepatitis A are the only source. It is so therefore the chronic carrier phase in case of hepatitis A does not occur. The person is generally only acutely infected who is the only source. The virus will replicate in the liver and will be excreted in the bile and therefore in the stools and feces. Therefore, we know that the transmission of hepatitis A is fecal-oral transmission from the stools and feces of an acutely infected person to another person. So, mode of spread can occur via the fecal-oral route due to consumption of contaminated food or person to person transmission. The incubation period is 15 to 45 days with an average of 28 days or 4 weeks. There is no carrier state in case of hepatitis A, whereas in hepatitis B and C there is carrier state. The clinical features of hepatitis A include four phases in which the first phase will be the incubation period, and then next after the incubation period where there is no actual signs and symptoms, there will be pre-icteric phase. So pre-icteric refers to before appearance of jaundice. So before there is actual clinical jaundice, there will be other symptoms which will be non-specific symptoms. It generally occurs 1 to 2 weeks before the onset of jaundice and will include normal features of fever like jaundice, anorexia, nausea, vomiting, poor appetite, fatigue, malaise, and headache. There will be no jaundice in this pre-icteric phase. However, low grade fever is more common in hepatitis A and E when compared to other hepatitis in pre-icteric phase. There will be vague upper abdominal pain also. In phase 3, it is known as symptomatic icteric phase where there will be appearance of jaundice, that is the clinical jaundice. So, do you know when does clinical jaundice actually appear? When there is the bilirubin is more than 3 gram per deciliter, then we will get actual jaundice which will be seen in a person as yellowish discoloration. uh, Prodromal symptoms will diminish in this case, which will be other fever, nausea, vomiting, malaise. All this will start decreasing, whereas clinical jaundice will appear in this phase. The urine will be dark and the stools will be pale, and liver will be enlarged and tender. There's splenomegaly and cervical lymphadenopathy in some cases, but not in everyone. Phase 4 is known as the recovery phase where the symptoms will disappear completely. In case of hepatitis A and E, it takes about 1 to 2 months. In case of hepatitis B and C, it takes about 3 to 4 months. Extrahepatic manifestations will include arthralgia and quickly fading rash. Other uncommon manifestations can also be seen, but generally, mostly arthralgia and rashes are the most common manifestations, which are also mostly seen in hepatitis B compared to hepatitis A. And prevention and prophylaxis. For preventing it, we have to have a good hygiene, we have to boil water. We know that it is a fecal oral transmission, so we have to have a good hygiene and boil water before drinking. Active immunization, we can give formaldehyde inactivated vaccine, hepatitis A vaccine, which is used generally after the age of 2 years and it provides a lifelong immunity. Passive immunization, normal human immunoglobulin can be given, that is 0.02 ml per kg intramuscularly if exposure occurs less than 2 weeks. So before 2 weeks of exposure, we have to give this immunoglobulin for protection for 3 months, and in case after this passive immunization, vaccine should also be administered. Let's look at the investigations required. So first we'll look at the urine. So there'll be bilirubinuria, which is the excretion of bilirubin in the urine. Also, the urinary urobilinogen will be increased. So normally the urinary urobilinogen will be increased. Bilirubinuria will be seen only in early stages. So hematological findings includes increased ESR, there will be leukopenia, that is decreased WBCs, relative lymphocytosis, that is the lymphocytes will increase because it is a viral infection. So we know that in viral infection generally the lymphocytes increase, and in bacterial infection the neutrophils increase. So since it is a viral infection, there will be relative lymphocytosis, and prothrombin time will be prolonged. So why will the prothrombin time be prolonged? Because the coagulation factors will be produced by the liver. So because of damage to the liver, there will be increase in prothrombin time, um, seen in patients. So it is one of the best indices of prognosis. Biological investigations includes aminotransferases, which is ALT, AST, will be increased and it will be maximum during the prodromal phase. In this case, ALT will be more than the AST, whereas in cirrhosis, AST will be more than ALT. But in hepatitis, ALT will be more than AST. The bilirubin is increased, both conjugated and unconjugated bilirubin will be increased equally. The ALP may or may not be elevated, the serum protein may be normal, and the blood glucose may be low. So now let's look at the serological tests available for HAV. We have to look at the anti-HAV antibody, that is anti-hepatitis A antibodies, which may be IgM or IgG. IgM, as we know, is generally denotes acute infection, whereas IgG is chronic, present for lifetime. So IgM will appear at the onset of symptoms. It is a reliable marker of acute infection. Whereas IgG, it will occur after the infection heals, that is after the recovery, and it provides lifelong immunity against the reinfection. It persists for years. Since the hepatitis A can never be chronic, after recovery there will be appearance of immunoglobulin G. Now let's look at the complications of hepatitis A. All the acute viral hepatitis will have these complications. So hepatic complications will include fulminant hepatitis. So it can progress to chronic hepatitis, but generally hepatitis A does not progress to chronic hepatitis. There can be cirrhosis, there can be hepatocellular carcinoma, there can be post hepatitis syndrome, there can be relapsing hepatitis or cholestatic viral hepatitis. But all these are generally not common in hepatitis A. Maybe fulminant hepatic failure and relapsing hepatitis may occur in hepatitis A, but others are not so common. Extrahepatic manifestations will include aplastic anemia, polyarthritis nodosa, henoch-Schönlein purpura, transverse myelitis, peripheral neuropathy, myocarditis, and renal failure. Let's look at the treatment of hepatitis A. The general measures will be to avoid alcohol and avoiding drugs which will be metabolized in the liver, since the liver is affected. Now the specific treatment of hepatitis A is not much. We just have to give symptomatic treatment and hydration to the patient. Because of nausea and vomiting, we have to give hydration, which includes 10% dextrose and normal saline. But generally there's no specific treatment for hepatitis A virus. So that's it about hepatitis A. Thank you.